amniotic fluid. The fetal vessels are present at two places. Number one is in the umbilical cord. Number two is in the this chorionic plate. Chorionic plate has chorionic blood vessel, which are the fetal blood vessels from where the fluid is filtered out through amniotic layer into the amniotic sac. Second is this umbilical cord, which is the produce its fluid from the umbilical arteries and veins that filtered out into the umbilical sac. Next source is the lungs. From the lungs that pour their secretion through the oral cavity into amniotic sac as the buccopharyngeal membrane ruptures. So from the lung, add its secretion into the amniotic sac from the lungs. These are the two lungs with the trachea, and from there the fluid is escaped, lung secretion, and that pass on into the amniotic sac. Next source is the kidney. The fluid passing through the kidney, it is just a watery, not a urine basically. It's simple water-like secretion that kidney excrete the urine which pass into urinary bladder, then enter into amniotic sac. So kidney is also another source of the production of the amniotic fluid. So secretion from the amniotic epithelium, number one, itself. Number two, the parietal decidua, this one, and decidua vidalis, and amniochorionic membrane, that from the decidua vidalis amniochorionic membrane fluid filter into the amniotic sac. Third source is this chorionic blood vessel from here. These are also chorionic blood vessel, chorionic frontosum, bush-like multiple blood vessels from which the fluid is filtered into through amniochorionic membrane into amniotic sac, and the umbilical cord also. Next source is lungs, from where the secretion is poured into amniotic sac. Next source is the kidney, which pour their urine, which is simple water-like, and poured into the amniotic sac. Another source is fetal skin, this one. This is the fetal skin surrounding it. Cutaneous blood vessels of the fetal skin, which is supplied by the cutaneous blood vessels, that pour its secretion into the amniotic sac. This is the next source. So filtration from fetal vessel by the chorionic plate or umbilical cord, then is the fetal urine, fetal lung secretion, and diffusion from the fetal skin. As gut develops, fetus swallows its own amniotic fluid, about 400 ml a day, half of the total amount. So fetus swallows its amniotic fluid, 400 bar, which is totally the 800 at full gestational period. So almost 400 it swallows from its amniotic fluid, and this fluid is absorbed into fetus circulation, and from the circulation it is passed on to the kidney, and kidney then excrete it out again to the amniotic sac. Daily contribution of the fluid to amniotic cavity from respiratory tract is, as I told you, lungs they pour their secretion, which daily production is 300 to 400 ml. Human fetal urine output is almost from the kidney 200 ml per kg per day. Volume of the amniotic fluid increases slowly, reaching approximately 30 ml at 10 weeks, 350 ml at 20 weeks of gestational period, and 700 to 1000 ml by 37th week. Next is the circulation of amniotic fluid. Water content of the amniotic fluid changes every 3 hours, which means that it is replaced every 3 hours. Large amount of water pass through amniochorionic membrane into maternal uterine capillaries that is pass there. Exchange also occur at umbilical cord where the exchange of fluid occur. Amniotic fluid is swallowed by the fetus, absorbed by the fetal respiratory and digestive tract. Fetal swallow the amniotic fluid and it is taken into respiratory tract and GIT. During the fetal stages of the pregnancy, fetus swallows up to 400 ml of amniotic fluid per day. That is the late stages of the in the during late stages of the this is the late stages of pregnancy. Fetus swallows up to 400 ml of amniotic fluid per day at full term. The fluid passes into the fetal blood stream and waste products in it cross the placental membrane, enter the maternal blood in intervillous space. So fluid pass into the fetal blood stream, waste product in it cross the placental membrane, enter the maternal blood, intervillous space. Excess water in fetal blood is excreted by fetal kidney and returned to amniotic sac through urinary tract. This is the amniotic sac fully surrounding the all around the fetus. This initial stage of the amniotic sac, below is the primary yolk sac. This expand and this is the chorionic cavity and it is filled by this. Now this sac is expanding and approaches the umbilical cord. It is further expanding over here and occupy this chorionic cavity. This is further expanding surrounding the all around the fetus but limited at the umbilical cord. This is the limitation. It's here it has fully surrounded and line all around the umbilical cord is fully surrounding it. Full stage. Composition of amniotic fluid. What is the its composition? Amniotic fluid is aqueous solution, watery solution in which desquamated fetal epithelial cells are suspended. These these cells are shed off from the amniotic layer. The amnioblasts which form the whole of the lining of the amniotic sac, their cells shed off in amniotic fluid. They are suspended. Amniotic fluid contain aqueous solution of organic compounds and inorganic salts. Half of the organic, they are proteins. Other half consist of carbohydrates, fats, enzymes, hormones, and pigments. So this is a composition of the amniotic fluid that it contains proteins, half of the protein. Other half consist of carbohydrate, fats, enzymes, hormones, and pigments. Study on the amniotic fluid can be done by amniocentesis. It is a process in which we remove the some amniotic fluid and study it. That is the removal of the some amount of amniotic fluid. That is the then we study the cell present in it, the desquamated cell present in it, carbohydrate amount, protein amount, fat, enzyme, hormone, pigments. We can judge from there the various diseases. Study of the cells. If you take up the cells from the or shed of cell in the amniotic fluid, which can be used for study of the cell in amniotic fluid, permit diagnosis of chromosomal abnormalities, trisomy 21 Down syndrome, hormone level, high level of alpha fetoprotein in amniotic fluid. We can test it, indicate presence of a Severe neural defect. We have already talked about the spina bifida, cystica, spina bifida, culta, and the anencephaly. So neural defect, low level if alpha fetoprotein in amniotic fluid indicate trisomy 21. So this is the significance of the amniotic fluid also. But the significance of amniotic fluid, embryo suspended in amniotic fluid by umbilical cord floats freely. Amniotic fluid has critical function in normal development of fetus. Number one, it acts as a barrier to infection because it is just a fluid bag surrounding the embryo, so act as a barrier to infection. It permits symmetric extended growth of the embryo. Growth of the embryo is made symmetrical, not the haphazard, up and down. So by its pressure, it makes the embryo symmetrical. Permit normal fetal lung development. The role of the amniotic fluid is fetal lung development is that the amniotic fluid is swallowed by the fetus, which enter into the GIT and into the lungs. Lungs are non-functioning at the moment, but amniotic fluid only enter into trachea and bronchi, not in the alveoli. Fluid put pressure on the alveoli and produce a rhythmic oscillation or rhythmic pressure, which permit the growth of the lungs. So this is a very important role of the amniotic fluid, that it promote the growth of the lung by simply putting the pressure on the lungs, developing lungs, that stimulate it by entering into trachea, and it cannot further pass on to alveoli because that is closed and developing at that time, not open. So that put just rhythmic pressure on it by which the lungs grow. If the amniotic fluid is less in amount and not entering into the trachea, lung fail to develop. The condition is the pulmonary hypoplasia. So it is very important that amniotic fluid amount, normal amount is very important for the development of lung. Those in which there is amniotic fluid is less, oligohydramnios, lung fail to develop, and fetus, newborn fail to breathe and death occur. So this is very important function of the amniotic fluid. It cushions the embryo from external injuries. Say mother get injury on the abdomen from outside, that prevent the embryo from the outside external injuries. It prevent from external injuries, or just like cushion it act on the embryo, which means protective cushion. Control embryo external body temperature. This is very important. It may be very hot outside at very cold outside, depend on the various countries where the temperature varies. There may be very hot, very cold, but the temperature is maintained by the amniotic fluid for the fetus, constant temperature, by covering it, and it is the control the embryo external body temperature. That is, fetus is not affected by very hot or very cold temperature. That is the constant temperature is maintained. It allows the fetus to move freely, so help in fetus move freely. By its moving freely, the muscle development by the movement of limbs, that assist in development of muscles. How? By the movements of the limbs. It also maintain electrolyte balance between the fetal and maternal circulation. Now, disorders of the amniotic fluid, which is very important to know. Number one, various terms are used with reference to the amniotic fluid, amount of the amniotic fluid. Number one, oligohydramnios. If amniotic fluid is less in amount. Number 2, anhydramnios, absent amniotic fluid. So oligohydramnios, that is the if the less amount of amniotic fluid, less than 500 say, is present, this is oligohydramnios. And if it is the no amniotic fluid, on ultrasound examination we can see, then it is the condition is anhydramnios, and this may cause the fetal death because the uterus will contract and compress the fetus and umbilical cord, because the amniotic fluid also prevent the fetus to be compressed by the uterine wall, and that is not compressed. So if no fluid, it will be easily compressed by the just simple uterine contraction. Polyhydramnios, amount of the amniotic fluid is excess of 2 liter. If the more than 2 liter, it is the polyhydramnios. Causes of number 1, oligohydramnios. Why the fluid become less? Placenta is insufficient. That is, placenta is not fully developed. So failure to secrete its secretion from the deciduovidalis, which is the major source of amniotic fluid, deciduovidalis and amniochorionic membrane that traverse through it. So if the deciduovidalis is not fully developed, blood vessel, amniotic fluid is not pass on by diffusion. Less amount will pass on. Number 2, diminish placental blood flow. If there is decreased blood flow to the placenta, amniotic fluid production will be also less, because amniotic fluid is derived from parietal deciduovidalis, and if there is diminished blood flow, umbilical arteries or veins also produce amniotic fluid. If there is less circulation, less fluid, and the best is the hypertension, in which is responsible for the vasoconstriction at the placenta, causes vasoconstriction and less blood flow to the fetus. Preterm rupture of the amniochorionic membrane. At the time of delivery or just before that, or any time from the 28th week or so, the amniochorionic membrane, which is made up of chorionic plate and amnio, that ruptures. Fluid escape through the cervix, through the vagina. So passage of the lot of fluid through the cervix and vagina, which indicate preterm rupture of the amniochor, because fluid will leak out, so it will lead to the oligohydramnios. And if the time is approached, say 32 weeks or more than that time, one can deliver the fetus immediately. That should be delivered immediately, otherwise it will be compressed and death of the fetus will occur. If there is a passage of large amount of fluid through vagina, indicate rupture of amniochorionic membrane. Oligohydramnios, if there is no other such cause, that placental insufficiency is not there, placental blood flow is normal, as one can check in the color Doppler study also, the preterm no rupture of the membrane, then what could be the cause? The major cause of the oligohydramnios, which is the most important cause, if first three are not present, this condition, that is renal agenesis. Oligohydramnios indicate that kidney failed to form. Although the kidney are not displaced are not the seen on the ultrasound, even then one can presume that major cause is renal agenesis, because the kidney, they are excreting its urine and contributing the major contribution to the amniotic fluid. If not contributed, renal agenesis, that is the oliguria will occur, and the anuria, no urine pass or less urine pass, amniotic fluid will be less. So oligohydramnios without any other cause Major cause is renal agenesis. Or another is related to urinary system is the obstructive uropathy, urinary tract obstruction. Another cause is the compression of umbilical cord. Umbilical cord is also source of production of amniotic fluid. If it is compressed by any mean, then lead to oligohydramnios. What could be the complication of the oligohydramnios? I told you that the oligohydramnios, if less fluid, less will be entering into the lungs. So lung fail to develop. Pulmonary hyperplasia, lung, because it produces rhythmicity while entering into the lung and promote its development. If the fluid is not entering and not promoting rhythmicity in the lungs, then they fail to develop and may lead to respiratory distress syndrome after birth or death of the fetus due to respiratory failure. Lung fail to develop, lead to the respiratory failure. Facial and limb development defects occur due to fetal compression. The uterus may compress if the fluid is less. It may compress. More affected is the face and limbs by the compression of fetus rather than thorax and abdomen. The face and limbs that is compressed due to fetal compression, the uterine wall. Uterus may compress it if there is less amount. The Putter sequence result from lethal pulmonary hypoplasia. Next is the polyhydramnios. The large amount of amniotic fluid for a given gestational age. If there is more amount, more than excess is the 2 liter. 60% is the idiopathic, no cause is known. 20% by maternal factors and 20% by fetal origin. The severe defect of CNS like mesoencephaly, if the head is partially failed to form, then is the amniotic fluid is not swallowed by the fetus. If it is not swallowed, then fluid will be accumulating in the amniotic cavity and polyhydramnios occur. The failure of swallowing is the reason is the head is not developed and the oral cavity is not formed and it is not swallowing, fetus is not swallowing the amniotic fluid, which is daily 400 ml per day. The esophageal, there might be the head is formed, fluid is swallowed, but esophagus is narrow, blockage, atresia. Duodenal atresia, if the duodenum is narrow, or esophageal atresia, esophagus is narrow, amniotic fluid is not further passing into GIT. So amniotic fluid accumulates because it cannot pass to the fetal stomach, not entering due to narrowing. This is a congenital condition. You will study in development of GIT system, how it occurs. So blockage or the duodenal atresia, narrowing of the duodenum. So one should presume in oligohydramnios the cause of the main many time cause is the esophageal atresia or duodenal atresia. This is the number one major cause of polyhydramnios. Maternal cause include cardiac renal prolapse, that is the cardiac and renal problems mother में, and the diabetic mellitus is also the causes of the polyhydramnios if mother is cardiac disease, renal problem and diabetes mellitus. There is another cause is the neuromuscular impairment of swelling, that is oral cavity is formed but the muscles of mastication which move the jaw and the nerves, they are not in full cooperation with each other, not make a contact. So neuromuscular impairment occur of swallowing. If that is fail to swallow, jaw is not moving properly and engulf the amniotic fluid. Polyhydramnios may lead to early rupture of the membrane also escape of the amniotic fluid. Normally, the amniotic fluid at the full term pregnancy or at the end of pregnancy responsible for the dilatation of the cervix and open the cervix for normal delivery. There is another condition, amniotic band syndrome, that is the in oligohydramnios which occur. The amniotic sac, if or anhydramnios or in oligohydramnios, if less fluid is there, the amniotic sac that surround the, especially the face and limbs that surround it and make the limbs anomalous. Constriction on the limb and a part of the limb may be failed to develop or it make the face compression on the face. That condition is amniotic band syndrome. It may result in a variety of the fetal birth defects. The defect caused by amniotic band syndrome vary from single digit constriction to major scalp. That a digit may be broken and may undergo constriction or the face, craniofacial or visceral defects. Cause of ABS are delamination of amnion due to rupturing or tearing causing on encircling amniotic band. Less amniotic fluid so that amniotic layer surround the fetus. Vascular disrupture, that is the number 2 cause. Premature rupture of the membrane, PROM, what the term used. It occurs before uterine contraction begin. Occur in 10% of pregnancy. Is common cause of preterm labor, premature labor. Usual cause is polyhydramnios that put the pressure, open the cervix and membrane rupture or infection may cause it. We study the amniotic fluid for diagnostic purpose. That is known as amniocentesis. Number 1, diagnostic amniocentesis. It is common invasive prenatal diagnostic procedure usually performed between the 15 and 18 weeks gestation. Amniotic fluid is sampled by inserting a 22 gauge needle through the mother anterior abdominal wall and then uterine wall into the amniotic cavity by piercing the amnion and chorion. That you just pass the needle from anterior abdominal wall, then the uterine wall, enter into the amniotic cavity. Then you draw the fluid from there. Because there is relatively little amniotic fluid before 14 weeks, amniocentesis is difficult to perform before this. One of the MCQ also. What is the time of the uh, amniocentesis after 14 weeks? Amniotic fluid volume is approximately 200 ml and 15 to 20 ml can be safely. So with how much we draw? 15 to 20 ml can be safely withdrawn. Diagnostic value of the why we draw the amniotic fluid. Amniocentesis is a common technique for detecting genetic disorder, for example Down syndrome, so that fetus can be aborted if there is a Down syndrome diagnosed in early stages and because the abnormal child is not required. The common indication for amniocentesis are advanced maternal age if more than 38 weeks because there is more chances of Down syndrome or the anomalous child. So if one is suspected that, then amniocentesis should be performed and study the cell present in the amniotic fluid for the trisomy 21. Previous birth of child, if there is history with trisomy 21, then should perform the amniocentesis for the next child. Chromosomal abnormalities in either parent, if that is there, then this should be examined. Women who are carrier of X-linked recessive disorder, for example, hemophilia. History of the neural tube defect in the family, spina bifida, cystica, carriers of inborn error of metabolism.